educational purposes down the road. So that we are going to go ahead and get started. I want to thank Taylor and Xander and some of the other team members who are on board with us today to help record and monitor the chat. Again, my name is Jose Melendres, and I am part of the Advisory Leadership Council to the Nevada Minority Health and Equity Coalition. I am also the Executive Director in the Office of Community Partnerships for the School of Public Health. Our co-presenters today are Dr. Julie Lucero from University of Nevada, Reno, where she is an associate professor with the School of Public Health and is the director over the Latino Research Center, and also serves on our board for the Nevada Minority Health and Equity Coalition. Our other presenter today is Dr. Christopher Johansson, who I'm excited is a new member to the School of Public Health here at UNLV and has a dynamic background in research and community-based participatory research, and he will be co-presenting with us today. Again, this is part one of a three-part series that we'll be doing around community-based participatory research. First part is what is CBPR? The second part, we will actually provide examples, presentations by faculty who utilize CBPR in their research and engaging communities. And then the third part will be more of an open question and answer session with some dialogue around how CBPR projects are funded or the type of funders that work out there to help us support this kind of work in the community. We also wanted to state that at any point, if you have questions and you want to speak up or something pops in your mind from part of one of the presentations, one of the comments that we make, feel free to put that question in the chat or raise your hand and we'll try to call on you. I think all of our presenters are open to this. Not only is it a presentation, but it'll be kind of an open dialogue format. So at any point during the hour and a half that we have, if you have a question or something, just raise your hand or put it into the chat and we will try to respond to it in a timely manner. With that being said, again, thank you to the Nevada Minority Health and Equity Coalition, the UNLV School of Public Health, and the Latino Research Center at University of Nevada, Reno for sponsoring this. This is part of our work with several different grants that we have received recently for the coalition on the behavioral health, mental health side, suicide prevention, awareness, opioid. There's a ton of stuff that the coalition is involved with and our schools, respective schools are involved with through the coalition. And for those of you attending the CBPR Institute, if you are representing a community-based organization and you become or are a member of the coalition, that one of the things that we strive for is any grants that we go after, that there be an opportunity to provide funding back into our community partners who would be able to do that work with us. So, FYI, this is kind of part one of being eligible to be able to do that. So thank you for joining us today. And we are going to go ahead and get started. So Taylor, if you could move us forward.
Thank you for that introduction, Jose. And before we get started about talking about CBPR, first we want to just define a few terms that you may or may not be familiar with. So I want to define research and evaluation. Research, as defined by Merriam-Webster, is a careful study that is done to find and report new knowledge about something. And typically in research, in institutions that conduct research, we want to generate hypotheses to test to answer our research questions that we may have, whereas evaluation is defined as by Merriam-Webster's determination of the value, nature, character, or quality of something or someone. And typically, we may be familiar with program evaluation, so evaluating or determining and making judgments or decisions based on results from that evaluation. And so, and we use that to see if our intervention or our program are working, or where then there might be needs to try to address our particular program or intervention. When we're talking about translation from research to practice, typically there's four levels of research, from T0 starting with basic biomedical research, so in the laboratory under the microscope, testing it on animals or other non-human subjects. In T1, we're kind of looking at starting to test it in human subjects, but at the clinical trial phase. phase 2, we're actually testing patients and trying to see if our treatments are working, are efficacious or feasible in human subjects. And then and from those results, if they're shown to be successful, trying to put that into practice. So whether it's a medical treatment for certain drugs or typically that's the case, and trying to see if that getting clinicians to kind of buy in and try that out in their populations, the human populations. And so there's a statistic that it takes on average about 17 years for that, from the T0 to T3 to T4, which is translating to communities. And so that's such a long lag that we need to utilize something like CBPR in order to fasten and close that gap to make sure we're able to disseminate findings as fast as possible, because typically the people the communities who need it the most may or may not receive that until way later on in our years later. And so that kind of also brings into a data call to action. So we have a lot of data that might be important, or that we might have access to, and then what are we going to do with that data? How are we going to actually bring to action or call to action different coalitions, different organizations to actually make use of this data, and in order to help us lead us into interventions, community-based participatory research that can assist, or that can actually help and close the health disparity gap in our communities.
And that's, I want to highlight some of that. So real quickly, just what Dr. Johansson mentioned, the CBPR, community-based participatory research, is kind of the priority for the coalition and how we engage our community partners and how we turn that data to action. A commitment from the coalition is that when we engage and we take on issues or policy or anything that has to do with the social determinants of health or health disparities as it pertains to diversity and equity communities, our method for approaching that work is CBPR. And again, that's where we take our community partners and they're engaged in the process with us. And so that we can, because we are committed that it's not just a bunch of meetings, that we take this data, we take this research that is done in collaboration with our community partners, and we do something with that. And so again, whether that's to influence policy, whether that's to work with the policymakers or provide information or critical to how to engage and work with our communities. And so that is hopefully what folks are going to take away from this CBPR Institute. Where we're going to show this next, where we're going to show this video next. Is there, we can't hear anything. Sorry, technical challenges.
You might need to reshare your screen, and there should be an option for sound, for sharing sound.
Sorry, Xander, what was that?
Stop sharing the screen and go to share it again. And when you click that at the very bottom, there should be an option to share sound.
Gotcha. Thank you.
Both program evaluation and research have objectives that include answering questions, and both collect and analyze data using similar methods to answer those questions. However, there are distinct differences between program evaluation and research. We can start with the purpose of each.
Okay.
Both program evaluation between program evaluation and research. We can start with the purpose of each. Program evaluation. Essentially, we can say that the purpose of a program evaluation is to collect information using rigorous methods and use that information to make judgments and decisions about an instructional program. The information collected is usually analyzed, and recommendations for the instructional design are shared with stakeholders within and outside of the organization. When we complete a program evaluation, the things we do include measuring learners' reactions to the instruction and changes in their attitudes or performance when they are in a performance context. Now, research. Research is focused on proving a theory or a hypothesis. Researchers hope to increase the body of knowledge on a particular topic. Data that is collected and analyzed is therefore used for testing theories or hypotheses. Research is usually shared through presentations and published articles.
All right, so we'll go to our next slide. Oh, no. Oh, we have a pop-up poll, folks. Please respond. So we will be having some pop-up polls throughout the session, so please feel free to respond. And again, if anybody has questions or comments during the session, feel free to raise your hand or put it in the chat. We will try to get to it. And thank you. There are some great comments about how to use this for the presentation. Thank you. Thank you, everyone. All right, very good. All right, let's move to our next slide, please. All right, so why CBPR? A big priority for us in doing this kind of research is, again, community engagement, make sure that our community partners are involved in the process. Again, whether that's a community-based organization, representative from an agency or organization, there's several folks on this call today that are part of agencies and organizations that we're working with. We're excited to have you all here. But again, communication is the process for where we create a space where we can collaborate and work with each other and make sure that everybody's issues, concerns, priorities are represented in the process. The part about coalitions, obviously, is that there can be a ton of issues and that we all have those areas that we're focused on, but through the coalition process, we try to kind of prioritize what will be critical that the coalition can get behind. And at different times, depending on folks' issues or concerns, those priorities can move up and down on the list. And thus communication and working together and constantly checking in with each other provides us with that space, building the space of respect and understanding how core issues impact different folks. And obviously, the big priority for the coalition this past year and a half has been everything revolving around the pandemic, COVID-19, and its impact on the communities here in Nevada. We've had the opportunity and privilege to work with multiple departments from DHHS, state of Nevada, and at the federal level around messaging, cultural competence, and inclusion of folks who need to be at the table as we continue to move through this pandemic. And now, God willing, as we continue to hopefully move beyond the pandemic and begin to address all of those other areas that were, before the pandemic hit, there was all the other areas of inequity that existed in public health. And obviously, a lot of those are starting to come back to the forefront. And so another element of CBPR is that it does allow us to approach it from a social justice lens, creates that space there. Again, goals under community engagement, establishing a place of trust, identifying new resources and allies in this effort, engendering better communication and different styles of communication. For example, we learned at one point, as you all know, not everybody has or utilizes technology. Not everybody has internet connections. So flyers, billboards, radio, television, some of those things are a little more expensive, but we had the capacity and the resources to be able to do some of that work to ensure that folks were receiving the information that they needed. And again, overall, our effort here is to improve overall health outcomes as successful individual projects built into or ongoing collaborations within our work. Next slide.
Teaching is a craft. It's both an art and a science, which is why great teachers always experiment and make tons of mistakes. But how do you know what's actually working? Well, one option is action research. Here you can identify a question, test out a strategy, gather data, and determine if it works. The end result is something dynamic, innovative, and tied directly to your classroom. Action research dissolves the barrier between the participants and the researchers. In other words, the teacher actively participates in the situation while also conducting the research. There are many action research frameworks, but they generally follow a similar process. You start out in phase 1, planning for research. Here you begin with inquiry, where you define a specific research question. It needs to be something that can actually be tested. Next, you conduct a literature review to gain a deeper understanding of the topic. Finally, you move into the design process, where you determine your data methods, consider ethical issues, get the required permissions, create deadlines, and set up the systems. Next, you move into the action phase. This is where you engage in multiple cycles of experimentation and data collection. Your data collection might include qualitative data like observations, artifacts, and interviews, or quantitative data like rubric scores, surveys, or achievement data. Afterward, you move to analysis. You'll often start by organizing the data with charts or graphs and looking for specific trends. You might also discuss it with peers, free write in a journal, or create a cluster map before eventually writing out your results. Finally, you have your conclusion. This is where you share your research with the world and reflect on your own practice. This will ultimately lead to newer questions, and the cycle will continue as you refine your craft as a better, more creative teacher.
And just real quick, I want to remind, we've had some folks join us since we started. If you joined us, please put your information into the chat, who you are, organization you're representing, all that. And also please be aware that this session is being recorded for educational purposes. Thank you. Next slide, please.
Great. So when we talk about community engagement in general, which is sort of the umbrella term for where CBPR sort of lives, we're often asked or confronted with the fact of what's the difference? Why would you do community engaged research that involves so many more steps than sort of traditional research, or what I call sole proprietor research? And so in this slide is what the answers to that, right? So sole proprietor research really is a one-man show or a one-woman show where the researcher or an academic, so the way I'm using researcher is really anybody that has research that is attached to their job description. And so for this particular training, that could be an evaluator or it could be a researcher. And so researchers exist in the academic sphere, they exist in the nonprofit sphere, and also within the state sort of public government sphere. And so sole proprietor research is often research that is done on a community. So the community is a passive subject of study. The research design is done a priori, so the academic institution or the researcher's institution decides how the research is going to be done. And then any of sort of the formative research or any of the follow-up research, needs assessment, data collection, implementation, and evaluation is done by the researcher. So they make the decisions on the entirety of the research process. And then unfortunately, just by the way that research has been conducted historically, a sustainability plan is not usually included. So we know that there's different kinds of research, right? There's exploratory, so we're just going to check and see what's going on. Descriptive, right? We're going to describe a phenomenon, or the experimental. And so for research, if we're trying to understand new knowledge and sort of apply that and add that to our knowledge base, sustainability hasn't usually been a priority for a lot of research. But now if you look at community engaged research involves the community in all of the research process. And so what I mean by community is really people that have a common interest, people that live in proximity to one another, people that have a shared interest in something, right? Some sort of phenomenon. And so that could be individuals that are community-based, or it could be organizations that are community-based. So that word community sort of has a lot of leeway, but nonetheless, what the crux of community is those individuals that are living in the situation or with the situation, whether that be a health outcome or a social situation. And so what we want to do is include them in the entirety of the research process, because at least from my perspective and the way that I describe community engagement, why I'm involved in community engagement, is the people that are living in the situation know the solutions. It's just because of sole proprietor research, we don't often include them in the research to get at those solutions. So then moving to the second bullet, the research design then also includes community voices. And so it's done with representatives of the community and the academic institution. So it's a partnership between community and academics. And you'll notice my language. So for sole proprietor research, it's research on, and community engaged research is research with, right? And so for that third bullet, the needs assessment, data collection, all the formative work and all of the subsequent data collection is everybody's responsibility. So it's the researcher and the community, in collaboration with one another. And then sustainability is a priority that begins at the very beginning of the program. So as you heard from Dr. Johansson in the very beginning, we want to make sure that data is actionable, right? That it's not just data that we collect, write a article for other academics, but it's actually data that is going to be used to better the situation of the community. And the other thing, the one last thing that I'll say about this and the previous slide is we talk about these goals of community engagement or community-based participatory research, right? Building trust, doing research with, and it sounds really good, right? In theory, but it takes a lot of work to get there. And you have so much dynamic that's going on with individuals that are involved in the partnership that there can be a lot of stumbling blocks. And so the beauty with the action research is that as you're doing it, you're also figuring out what's working and what's not working within the partnership, and then with all of the decisions that are being made within the research. Next slide. So this is a graphic, an illustration of all of the different kinds of community engaged research. So all of the different levels of partnership that fall within the umbrella of community engaged research. And so on the most left side is outreach, and that's generally where partnerships start. Right, so there's some involvement of the community, but for the most part, it's somebody, a researcher, an evaluator, or an organization coming to the community to provide information and then maybe to get a little bit of information back. Consultation is a more improvement, seeking feedback, asking entities to share information, and then you're developing connections, but you're not really collaborating, right? These are just the starts. When you're involving community, then it's better involvement, right? So we're moving closer to shared leadership. There's participatory communication. The community participates. There's a visible partnership and increased cooperation. So in the involvement, there might be a situation where you know who to call, right? An academic, in my case, I would know who to call in a community organization or a community representative. But there's still not a whole lot of shared leadership. But then in the collaboration stage and the shared leadership, we really start to get there. And what we want to end up at is shared leadership, which is the most right. And that's where the community is completely involved. The community makes all of the final decisions. It's a solid relationship so that trust has been developed. And we all know that trust is super fragile, right? And it can fracture at any moment. And so in this relationship, the shared leadership, there's maybe there's an opportunity for fracturing, but then it'll be taken care of easier, right? It's easier to get back to where you were started. And so that bidirectional trust growth. And then there's a larger agenda. It's not just about the one project, but it's a larger agenda. And so at the bottom of this slide, you can see the promise to the community. And so from outreach all the way to shared leadership, there's an increasing promise to community about participation and about shared leadership. So that at the very right side of the screen, under the shared leadership, the final decision-making process is put in the hands of the community. And we know from historical research practices that this is where we want our communities to be, right? We want them to be able to know what decisions that they can make, what they can ask of community, and how much they can participate in the research process. Okay, next slide.
Yeah, so why the need for community-based participatory research? Dr. Lucero touched on a few historical issues. Typically, we're sole proprietor researchers, so the researchers going into communities, using communities as a laboratory, and then just leaving, not having a sustainability plan. Sometimes researchers will go into a community, conduct their research on issue X, but the community really needed researchers to conduct research on issue Y, because there was a need in the community and there was a lack of communication. There's little to no trust, because they're having different competing needs and priorities. And so communities typically the communities that are impacted the most by these health inequities are least likely to be involved in the research project as well. And that may be due to hesitancy to talk with researchers or meet with researchers. Again, that's a kind of a lack of trust. There's also, historically, there's been also some distrust with researchers doing unethical things. So unethical things on human subjects. So even building that trust, having a community partnership to establish that we're going to share leadership. You're going to be a part of the research every step of the way, to kind of help build trust, bridge that trust gap, so that community members would want to continue to do conduct participatory research with researchers. And sometimes, again, there's also it's not tailored to the concern, so I kind of touched on that earlier. And then also there's a lack of communication with the communities every step of the way. So community-based participatory research aims to have a different paradigm in which the community members are part of every aspect, from designing the research question, helping with hypotheses, generating hypotheses, what may happen, helping if it's an intervention, helping give lots of input about the community, and because they're the experts, they know that their community may be open to this certain part of an intervention, but not this. So that's where a lot of different other issues come into play, such as cultural relevance to your community. And so, yeah, definitely. And then also little attention is paid to broader social and structural determinants. So again, kind of going back to researchers just might be coming in for not be familiar with the community, not have that trust. So they lack understanding and context of what might be most important to community members. Next slide.
Thank you, Chris. Thank you. So the next slide, what is community-based participatory research? And again, we, at the core of this, it's where we engage those community partners, whether they are community members, organizational representatives, academic researchers, in all aspects, developing the questions, developing survey tools, training folks how to conduct a one-on-one interview, how to run a focus group. All those different areas. If you're working with the university, then, for example, we have our human protection issues that we need to provide. And so those are all different things that our community partners, you would be trained, and you would understand how that process works as you go out there and participate and engage in the process. It enables our partners to contribute their expertise. As a community-based social worker, that's where my training is. Critical, anything I do in the community, priority for me, especially from a social justice lens, that who are the experts, who are the folks that are living in those communities, who are dealing with the day-to-day issues. Those are our community experts. Those are the folks who need to be at the table with us when we're doing this kind of high impact research, action-oriented research that we strive for, to make sure that our voices are included at all levels. During this pandemic, Governor Sisolak identified and designated racism as a public health issue. And so that is critical to our work here in Nevada, and how we all engage in the process, the whole process of vaccine equity, making sure that our partners are at the table voicing and making sure that we're doing this in an equitable and social justice way. Again, through CBPR, it enhances the understanding of a given phenomena, what's going on out there, why are certain communities being impacted. Again, I'll give an example. During the pandemic, the COVID-19, when you looked at who was at the top of the list of either getting sick or dying, in Nevada, at one point, it was African Americans. At another point, it was Latinos, Latinx. At another point, it was our Filipino community. Our LGBTQ community is mixed in throughout that, with that intersection. So just a lot of groups, and unfortunately, constantly our Native American population being impacted by this. So it's critical, and CBPR gives us a place to understand whatever the phenomena, whatever the issues that we're looking at, for us to work together and address it. Again, a critical part here, integrates the knowledge gained with the action to improve the health and well-being of our community members. So as we're going through the process, understand CBPR, how we use it on the community side and the academic side, that we begin to develop actions, to begin to develop how we're going to approach or address those issues, understanding that everybody's going to come to it from a different perspective, a different lived experience. So those are all critical elements. And ultimately, our work to either establish culturally relevant, culturally competent interventions and policy changes that our legislators and those policymakers need to be thinking about. And again, something that this is gonna build into is understanding the place of cultural competence and the place of cultural humility when we utilize CBPR, if we're utilizing it correctly. And so I think Dr. Johansson is going to go into a little bit about cultural competency. Next slide. I think we have a video.
One of the worst, yet easiest mistakes people can make is to assume that other people are just like them. People from different cultures see and do things in many different ways. Let's take a look at cultural competence. Cultural competence is the ability to interact effectively with people of different cultures. A culturally competent person has the respectful awareness and understanding of cultural differences. There are 4 components to cultural competence. Let's take a look at each. First is awareness of our own cultural worldviews and our reactions to people that are different. Next is our attitude towards cultural differences. This reflects a willingness to honestly understand our beliefs and values about cultural difference. Third are our cross-cultural skills. This component addresses the importance of practicing cultural competence, including nonverbal communication, to become effective cross-culturally. Although some people are more naturally culturally competent, most of us have to put an effort into developing this skill. This requires honestly examining our prejudices and biases, actively developing cross-cultural skills, learning from role models, and having a positive attitude about cultural issues. The key to cross-cultural success is awareness. Being aware of how culture influences your interpretation of others, your own behavior, and how people from other cultures may see you. Understanding why we do things in certain ways, how we see the world, and why we react the way we do is an important part of being culturally aware. Cultural awareness can improve performance in culturally diverse organizations or when an organization's customers are diverse.
Yeah, so I also just wanted to highlight cultural competence is also, in addition to what they're saying, what the clip showed about awareness, it's also understanding and admitting you're not an expert in cultural competency, and you may never be, but you're also able to show that you can empathize with communities that may be different, that have different cultures from yourself, from your own, and also to understand that diversity is a good thing. So definitely having trainings as well in cultural competency for your potential community of interest or community you may want to work with, definitely help establishing again that trust when you are developing community-based participatory research questions and studies.
Next is a video on cultural humility.
One word to describe cultural humility for me is love, actually. If I had to encapsulate cultural humility, the whole concepts of cultural humility, it doesn't do it justice, but the word that I think of it is essence.
Escuchar.
Being.
You.
Opening.
Receive. Compassion.
Love.
The principles of cultural humility offer one more framework to contribute to what has got to be our ultimate goal, yes? Our ultimate goal is that there will be a sense of equity, a sense of equality, and a kind of respect that we are driving forward.
Cultural humility is a multi-dimensional concept, and certainly Melanie Tervalon and I conceptualized 3 dimensions.
The first is lifelong learning and critical self-reflection. And in that critical self-reflection, it is the understanding of how each of us, every single one of us, is a complicated, multidimensional human being. Each of us comes with our own histories and stories, our heritage, our point of view. You're looking at me now. I am very fair-skinned. When I was a little girl, my hair was blonde. My eyes are blue. People often tried to call me anything but African American. I have a history. My identity is rooted in that history. My parents gave me the knowledge of my own social identity, and my own experience in life has created that. I get to say who I am.
The second tenet, after self-reflection and ongoing lifelong learning and development, is this notion that we must mitigate the power imbalances, to recognize and mitigate the power imbalances that are inherent often in our clinician patient or clinician client or service provider community dynamics.
And then finally, the piece that I would offer that Jan and I feel people often either don't read or don't like, which is, and the institution has to model these principles as well.
Is there a poll or no poll?
Not on this one.
Oh, okay. Yeah, so Jose and I are going to kind of touch on some differences between, or contrast between culture of competency and culture of humility. In culture of competency, as you may recall from the clip, there's 4 key components: awareness of your own cultural worldview, attitude towards cultural differences, knowledge of different cultural practices and worldviews, and cross-cultural skills. So we could try to use, strive for, trying to achieve cultural competency when we're conducting our CBPR, whether it's developing or implementing health programs or adapting interventions to make it to adapt it to be culturally tailored to a population or community of interest that addresses our health inequities or disparities, while all the while being aware of cultural competency. There's even legislation passed in 2019 that here in Nevada that concerning cultural competency. So it requires medical facilities to conduct training relating specifically to cultural competency. So a staff member is able to understand patients and or residents who have different cultural backgrounds, and specifically in the law it states that they must have competency and awareness from various gender, racial, and ethnic backgrounds, religious backgrounds, LGBTQ, children and senior citizens, people with mental or physical disabilities, and or any part of any population that an employee or agent may need to better understand in order to do their job.
And so then just quickly on this is, I think most of you who are service providers and working in those areas know that through SB 470, there is now required training in place that allows you to obtain a cultural competence certificate of training. And I think right now there are 2 entities that do that. The Making Health Nevada, Making Health Happen in Nevada, the Public Health Training Center out of UNR, and then the High Sierra, Northern Nevada High Sierra AHEC is another one that's the training. We'll put that information in the chat for those of you. They're both very good trainings. I've completed both, but you've got to commit. They're both 3-day trainings, 3 hours every day, 9 hours. There's a fee for that, but it's required by the state of Nevada. But they are both good resources. The next slide then goes a little bit into, for me, from my perspective, again, I'm a trained social worker. I've done community engagement work for longer than I like to admit, but it's been exciting every step of the way. But for me, the next level is cultural humility. Cultural competence offers us basic skills that we all need to be aware of. But cultural humility really takes it to the next level of understanding myself as a Latino male. I will never understand or know what it's actually like to walk in the shoes of a Latina female. I will never understand what it's like to walk in the shoes of an African American or any. So, but by continuing to educate myself, by continuing to make myself aware and in the moment, I can be an ally, I can be a resource, I can work with those populations to address whatever issues we are addressing. And I would tell you this, it's an ongoing, even though I've done diversity work for 20 years now, plus in higher education, I do not consider myself an expert in any of those areas. It's a constant learning process. There's always something new to learn, people to learn from. And so when we look at cultural humility, again, understanding the levels, understanding intrapersonal and interpersonal skill sets. Core components include lifelong learning and critical self-reflection, recognizing and challenging power imbalances, and institutional accountability, whatever that institution might look like. Here at UNLV, for example, with the School of Public Health, collaborating and partnering with the Nevada Minority Health and Equity Coalition. I, for myself, have to constantly kind of step back and make sure that I'm creating that safe space, that safe environment for our community partners who engage with the coalition, the leadership of the coalition, the work of the coalition, all the multiple grants that we're working on right now in delivery across the state of Nevada. Again, creating that space for all of us to acknowledge that there's still a lot of work that we need to do. And again, looking at when you put on top of that a social justice lens, kind of from my perspective, again, from me, the responsibility that I have to the community that I serve. So, thinking about what that means to each of us from your perspective, from your lived experience, and from where you sit, whether it's institutional or community-based, whatever that looks like, understanding that place. So understanding the both between cultural competence and cultural humility. I think for us, we wanted to include this in this presentation on CBPR because those are critical elements if we're implementing CBPR methods in a social justice way to impact and to support everybody that we need to work with us to move these efforts forward. Next slide. Oh, and by the way, I know there was some questions in the chat regarding would this recording be available? Yes, this will be available to everybody. And also in the chat, we'll put it in there again. We have created a kind of PDF guidebook that goes along with this presentation. It is in the chat already. You can download it. That's available. And throughout the 3 sessions, we will be constantly updating that guidebook as more information comes forward. So anybody from your experience, if there's other resources you know of or that you've been a part of that has an emphasis or utilizes CBPR, feel free to put that in the chat and we'll make sure that that gets into the guidebook as we move forward over the next 3 weeks. All right. Principles of community-based participatory research.
So one of the most frustrating things, I think, for new researchers or for anybody who's new to community-based participatory research is that there's no recipe, right? Every partnership is new, every partnership is different. I think very early on in my career, the most useful advice that I got from a community partner was the only thing that is consistent about CBPR partnerships is that they're all going to be different. And so you should, if you are planning to embark on this kind of research, just know that even if you have experience, your next partnership might be very different, even though it might have some similar characteristics as past partnerships. So here are a list of principles that Barbara Israel and Amy Schultz and colleagues had developed. They actually developed in 1998 a list of 9 principles from a literature review of all of the academic articles that have been published on CBPR and community engagement. And then here we're showing 8 of them. And if you'll notice, items 1, 4, 6, and 8 all refer to the partnership, right? So the academics and the community members or organizational members that make up the partnership. And then numbers 2, 3, 5, and 7 are about the community. So the community, when we say community-based, it's not necessarily working with the entire community, right? It might be working with representatives, organizations, as we've already stated in previous slides. The other thing about these principles is that in about 2013, Barbara Israel and colleagues wrote a book chapter, and they said, you know, we went ahead in 98 and we developed these principles. And for some reason, the academic community sort of grabbed onto them as Bible. And she said that this isn't necessarily the case. This is what it is that we learned from what people had written about. But what every partnership needs to do is make sure that they have a conversation with each other to find out what principles are most important to their partnership. And these ended up being more of ideas or guidelines, principles that could evolve for a particular partnership. And so you'll notice that a lot of these really are ideals, right? And these are things for us to strive towards. So promoting collaborative and equitable partnerships in all phases of the research, including empowerment and power sharing. So we know that whoever holds the purse strings really has a lot of power, right? And so having the conversation, making sure that all partners understand, you know, where the buck stops, you know, having those conversations for an equitable partnership. What does that mean for your particular partnership? In line with population health sciences is number 2. So recognizing that community is the unit of identity. Most often public health research focuses on individuals because they're easier to study, right? They're easier to work with rather than a community. However, in CBPR and in CBPR ethics, community is the unit of identity. And so we want to make sure that community is at the forefront. That is how we are interpreting our results, and that is how we are sharing and disseminating our results. Number 3 is built on the strength and resources of the community. This is one very important reason why a needs assessment and all of that formative research is very important to understand really what are the strengths and the resources. In public health research and lots of research, we come from a deficit perspective where everything is wrong, right? But we know that our communities have so many strengths and so many resources that if we started to build on those, then we're not looking at a deficit, we're looking at this from the strengths-based. Number 4 is something that we don't know very much about. So facilitating co-learning and capacity building. Capacity building takes a lot of time, right? If a community partner or organization hasn't really had experience with research, we want to make sure that they fully understand what research is, right? So we build that training. And I often get asked by some of my research or academic colleagues that why would you include a community member if they don't know what research is? Well, we include undergraduates all the time in our research, right? And we build capacity with undergraduates so that they can continue to do research in their career. It's no different working with community. In fact, they teach academics quite a lot more than we could possibly teach them. I'm working on a team of 3 right now with some really incredible women, and we're having a lot of conversations about what these look like. What is collaboration in our partnership? What's power sharing? What is community capacity building, or what does capacity building look like? Who from the community do we bring in to be part of, and the voices, the representation of the larger community? And then when we start looking at communities as these broad umbrella terms, such as the Latino community, right? There's so much diversity within that umbrella term, or American Indian or Black, that we really need to understand for ourselves, what community is it that we're talking about, right? Just like Jose said, you know, being able to understand who we are and not being able to walk in other shoes, that diversity within that umbrella term that we are working with, we need to understand the experiences of the other of our partners that maybe don't identify the same way that we do, right? So anyways, if you drop down to number 6, this is the action, right? The data to action piece, that we want to make sure that there's a balance between research and action. So the partnership is a collaboration between academics and community partners. And so we need to make sure that there's mutual benefit for everybody. Academics have to publish. Academics have to get more research grants. Academics need to, but community needs to be responsible to what they say their organization is doing, their mission. They also need to publish, and they also need to get additional funding, right? So making sure that that conversation is happening. And then disseminating those findings. There are lots of different ways that we can disseminate. I'm in a collaboration on a book chapter with Erica, Dr. Marquez, who's on the call, and she has just some amazing ideas about alternative or different ways of disseminating information. And that could be, you know, a poster presentation, you know, obviously the writing of journal articles, a theater event. It can be, you know, an article in newsletter. There are so many ways that we can disseminate findings so that it reaches a greater audience than what it is that we originally intend, or what we typically intend. And then number 8 is probably one of the hardest things, because funding sort of necessitates participation. When that funding goes away, what happens to the partnership? And so this is what we talked about earlier, where a long-term process and commitment to sustainability really needs to be determined in the very beginning. So having the conversation of, does our partnership last after this funding goes away? What is our next step? Does the network stay together? Does the intervention stay together? What is it that we're talking about when we think about sustainability, right? So, so these are some things to talk about with your partners. As I said in the beginning of this slide, there is no recipe, but these could be some guiding, something to guide the conversation when a partnership first gets together, or even if you're in the middle of your partnership. And needing to have that conversation about what next, or how are we doing?
Dr. Lucero, we have a question in the chat that I think fits nicely in here at this point. And I think you alluded to some of that during going over the 8 points, but the question was, what would be the biggest barriers in our state of Nevada for to have Latino population-based CBPR?
So I don't know that there is, I think if depending on who you ask, they will have different answers. But some, especially I'll talk about the North because I'm in Reno. We do not have a cohesive network of Latino organizations. And so we are very diffuse. And so working with one organization means that you're working with one organization and you're not working with the Latino community, right? So that's one issue. Another is what are we talking about when we say Latino? In the North, I think we have a larger population of Mexican Latinos, but we also know that there are people that are here from, that originate from, from Guatemala, from Nicaragua, right? And so as a part of that, they're more of a minority within our Latino community. So then how do we make sure that we're representing the entire group, right? And then how are we making sure that we're adding those voices into our projects? The Latino Research Center has tried to do a community needs assessment, and we have some data. So we know what some priorities are, but that once again isn't a representative sample. So we're not entirely, we don't have our fingers on the pulse of really what are the issues that are most important that we should be identifying or that we should be putting resources towards. And then the resources, there's always, in public health in general, there's such a shortage of resources that's something that collaboration does, right? It maximizes our resources. And when you have organizations that aren't necessarily working so closely together, then there becomes a fight for resources instead of collaboration. So the more that we can talk with each other and figure out what everybody is doing and how we can work together, the more we're going to maximize those resources, the more benefit we're going to bring to community. So that's my, those are my opinions, and that's what I am seeing. Jose?
Thank you. Dr. Johansson, anything you'd like to add on this part, on this question?
Yeah, I would just want to add that my background is in addressing Latino health disparities. So, and my background is also focusing on chronic diseases, chronic conditions such as diabetes, obesity, and cancer. So definitely, Dr. Calderon, thank you for that question. And if there's an interest, and if there's an interest in those kind of health issues, I could give you my contact information, and we could talk some more about that. Since I'm still getting new to the landscape and trying to establish some of these relationships with the community here in Southern Nevada myself.
Thank you, Chris. And then I'll just point out real quickly to that point, Dr. Calderon, you know, the coalition, I think we're now in our 10th year of operation as a coalition. And when we were first created, we were actually in collaboration. I think Tina Dorch is on the call or was on the call, the manager for the Nevada Office of Minority Health and Equity. And so when that office was established, the coalition was created to collaborate and work directly with that office for resources, for training, for data, research, all those kind of things. The other side of it was for the coalition to also be a place where we could work with the state of Nevada to hold them accountable, make sure that diversity and equity was at the table. And I'll tell you this, especially why we really kind of push CBPR, because that CBPR, if you understand CBPR and you're applying those methods, it creates that space, it creates that environment for folks to be engaged at whatever level they're able to engage. And I can guarantee you this, every project is going to be different. Every time you bring a group to the table to address, whether it's racism in public health, whether it's healthy eating, quality of living, asthma, you know, whatever it is, every time it's going to be a different group with different concerns and different issues. And that's where the resources are critical. We've been very fortunate. The state of Nevada has funded us. As Dr. Lucero mentioned, public health isn't always well funded. Right now they're throwing money at us to do this work, and CBPR for me is definitely one method that we create that space for community members to be involved, to have a voice, to be at the table with the decision-making process. And that's the part I love about CBPR. But be ready. If you adopt and utilize these methods, every time you get involved with the group, it's going to be a different standard or different things that you're going to have to think about. But you have that space, and you begin to create that reputation, and you begin to build that trust, which is critical in order to do this work, ensuring that community voice is at the table. And yeah, because those barriers exist across the board. And Latino issues in Southern Nevada are going to be very different from Latino issues in rural Nevada, and then different from Northern Nevada. I get amazed. I sit on multiple boards and multiple committee meetings across the state, and what Latinos are dealing with in the North are very different from the South. What African Americans dealing in the North are different from the South. The common thread is that there's still a lot of inequities that exist in public health, and that's why we're all on this call today, and all of us do the work that we do, right? And so hopefully, what you take away from today's session and the next couple of sessions is how you can utilize CBPR as a tool for engaging diverse communities. All right, I think Dr. Lucero, you're up with the next slide.
So the process of research, whether you're using community engagement or not, is the same, right? You develop research questions, you collect data, right, so on and so on. The thing that is so unique to community engaged projects and CBPR in particular is that you develop the partnership. And the partnership has to be, should be, right, developed before any sort of application goes in for funding, because you really want to understand what the community needs are, what their desires are, what their health priorities are, or social priorities are, to do the research about. And so when you're forming the CBPR partnership, then there's this organizational structure and developing of operating norms that needs to happen. And this is where a lot of folks say CBPR takes a lot of time. And it does, right? Because relationships take time. I mean, think about your partner, your life partner, or your best friend. How long did it take for you to get where you're at now, right? It didn't happen overnight. It didn't take a week. It's taken time. Some are shorter, some are longer, just depending on the dynamics that come with the individual and the relationship. But with that is, developing, forming the partnership. If we start with the yellow circle, assessing community strengths and dynamics, having those conversations around that, defining the public priority health issue, and research questions. Oftentimes we know that, with research questions, we don't nail it the first time, right? We don't come up with a question and it's the best question ever, and that's what we run with. We're constantly revising it. And so when we're revising that health issue, or when we're revising that research question to get at the health issues, we're also looking for funding, right? To see what it is that might fit with that. And we're trying to be creative about, the social determinants, everything that happens around that health issue, to make sure that we're meeting everybody's priorities. And then we go into, designing and conducting the study, whether it's going to be an intervention, policy, right? How we go about doing that. And the other thing about, just really quick about the designing the project is, depending on the expertise that comes to the table around research design, there are some very specific things that might be brought to the table. So for example, in an experimental design, a randomized controlled trial is the gold standard of research. However, in a lot of communities, at least in my experience, the communities that I've worked with, they really felt that it was unethical to have a control group, right? So we have this issue, this health issue. We have a potential solution, and then we're going to have a group that's going to be doing business as usual, right? We're not going to give them anything, even though we know that there's this health issue. And so, so for a lot of groups that I've worked with is they've said, no, randomized control trials are not appropriate. So we might do an intervention light and then an intervention, full intervention. So there needs to be that conversation about really what is the most appropriate for the community. And then also with, when it comes to culture, how much culture should be brought into the intervention? What does that look like? What are those cultural aspects that we want to bring in? Because culture for a lot of health issues is a protective factor. And so why do we want to ignore that when we can actually bring it in and build upon the strengths of the community? And then when we come back to, the feedback and interpretation of the research findings, we absolutely have to include community voice, the people that have been working with us this entire time, because they are closer to the community. Even if we feel that we are a member of the community, and I'm speaking from an academic perspective, we still have the culture of academia that is still within ourselves, that we need to be brought back to what does it really look like with the lived experience. Even if, we've been there once, we've changed when you're an academic, right? That's just the way that academics works. And so making sure that we're including the voices of the community into those research findings, and also in the disseminating and translating. So the next slide that I'm going to show you is kind of the same thing. So it's showing you the spectrum of research from, generating the idea and the issue definition all the way to action. But in this, the difference between this and the other one is that there are some key questions here that really need to be asked within a community-based participatory research partnership. So in the very beginning of a research project or a CBPR project, we need to ask ourselves and the partnership, how are decisions being made? So if you remember back to the principles of CBPR, right, we want to neutralize power. We want to make it horizontal so that everybody has a voice. But then also what knowledge is being privileged. We talk about cultural competence and cultural humility, and that sort of works as, throughout the research process. But even in the very beginning, research is not culturally neutral. What we bring to the table is everything from our worldview. And so whose knowledge then is being privileged when we're talking about, the research questions, what is important? And this is, sort of falls in line with that decolonizing research, right? Who's privileged, who's going to get funded, and how then do we negotiate that knowledge? And then to what extent are all partners involved? When we start to get down into asking the research questions, generating the hypothesis, the research design, and the data collection, we need to ask ourselves who approves the research. So for academics, we go through our institutional review board, but also in communities, there are some communities that have their own research review boards. American Indian communities have their own research reviews, some have their own IRBs, or some have just their own tribal councils that review the research. Organizations may have something similar where they review the research prior to it being going out for funding. So we also need to ask ourselves, what are the risks and benefits of raising the topic? So just raising the topic of, I want to study suicide in this community. What does that then bring up for community members? Is that something that's going to halt the research in its tracks? Does it have to be part of a larger conversation? What are some taboos around bringing up things in particular communities and particular cultures? And then I mentioned this already, the design and the methods, are they appropriate? The risks and the benefits of the research. In academics, we generally say, what are the physical harms? Do the harms outweigh the risks? But for a lot of other communities, there are social risks, legal risks, internalized stigma that could be a risk, right? We need to think about risks way more generally than what an IRB tells us we should be thinking about. And then I'll go through these next ones quickly, but how are data being collected? Is it the most appropriate way to collect the data? What is being done with the data? Who owns the data? How are data being interpreted? I'll tell you a really quick story. I worked with a woman who was a member of the Navajo Nation. And she had gone to school, has her PhD, went out to go do some focus groups with some elders, and quickly realized that it was not going to go according to textbook. Each individual started telling their story, and a 60-minute focus group ended up spanning 2 days. So she had to be there, listen. They broke for the day, came back the next day, because that culturally was appropriate for how the focus group was going to be done. We also know in a lot of communities, you don't go in and start asking questions, right? You don't walk into somebody's house, sit down and start the interview. You have coffee, you talk to people, you ask them about how their family is. And that takes much more time than what the textbook tells us. And then finally, where is knowledge being shared? So who benefits from this knowledge? It needs to, within this approach to research, benefit everybody that is involved. And so where is the knowledge being shared? How do we get it to people so that they can use it to their benefit? And then what happens to the new knowledge, right? We also need to make sure that what we are sharing isn't going to be appropriated or co-opted. So what happens to it? How is it being shared? And then how is the data being actionable? So there's a lot of thought, a lot of forethought that needs to go into these relationships. And so hence the time commitment that comes with it. But there's also a lot of negotiation that needs to happen, right? Just a lot that needs to happen. And the other thing the last thing that I'll say about this slide is there's going to be conflict all the way across here. So if you plan for conflict, knowing that it's going to happen, because as human beings, we are relational and we come with different perspectives, different culture, right? We interpret things differently. If you plan for conflict, you make conflict okay, then when it arises, then you have a plan for knowing how to deal with it. Next slide.
Thank you. Thank you, Dr. Lucero. I know that was a lot. And so we are coming to our last couple of slides. Again, if you have any questions, concerns, whatever, please put it in the chat, or hopefully we'll have a little bit of time for some question and answer. If folks want to stay on a little bit past 1 o'clock, I think we can. But so real quick, again, benefits of using CBPR. Again, the relevance and use of data, it's immediate. If you're doing this, as you're learning things, you're able to start thinking about how you might apply or address certain concerns. Enhances quality and validity of the research, again, because if we're doing this right, those folks who are being impacted by whatever the issue is are at the table with you, right? We're training, they're working with us to look at the data, collect the data, interpret the data, and how we engage with those communities. Again, by including our community partners, it strengthens the intervention design and implementation, both from the recruitment component and the retention component, and then hopefully the impact, right? That the outcomes are going to be immediate and things that we can start to look at and hearing the voice of our community partners. Again, knowledge gained and interventions benefit the community immediately, directly, provides resources for communities involved, again, with the coalition and our work, any grants that we go after or that are awarded to us so that they came looking for us. We have one question: that can we take those financial resources, excuse me, and put them back into our community partners who we're going to invite, because they might have the population we're working with or the demographics, and we're going to invite them to the table. We don't expect them to do it for free. We are going to put resources into the community to do this work. It's a critical component of how the coalition approaches our community-based work. Joining partners, again, ensuring that we are working with diverse communities. They're the experts in the community and bringing them to the table to address those complex health problems. Again, with the COVID-19 work, our communities have included African-American, Latino, Latinx, Native American, Asian, Pacific Islander, LGBTQI+, deaf and hard of hearing, and then the intersection within all of those communities as we work and reach out to address whatever issues we're working on. Again, critical in CBPR is increases trust and bridges bridges cultural gaps between partners. The more we work together, the more we begin to build trust, the more we begin to understand how to communicate with each other. I love the story that Dr. Lucero shared about our Native American community. I've had similar experiences in the Latino community where you thought it was going to be a 60-minute interview, and I walk out of there 4 hours later and full from the food and the cafecito and the pan dulce and all the other things that came with that process. So be open to that, be ready for that process, right? And then has potential to translate research findings to guide development and further interventions policy. Again, we have been very fortunate during this time that, and I'm so grateful to our state partners at DHHS, behavioral health, the other areas, that they have just been open to the process and constantly working with us and hearing us on how to best engage with the communities that we try to work with. And I know several of them are on the call today. So I just want to send a big shout out to all of you because you very much have been involved in the process and inclusive in bringing us, or maybe I just need to learn how to say no to so many meetings, but it's been an incredible experience in dealing with the COVID. And now as we start to prepare for everything that's going to be post-COVID, post-pandemic, the mental health, the behavioral health, the suicide awareness, all those things that we know, those numbers have unfortunately jumped up in the diversity and equity populations that we work with. Can we go to the next slide? Again, areas of the coalition that we deal with, again, social determinants of health as prescribed by the CDC, education access and quality, healthcare access and quality, neighborhood in the built environment, social community context, economic stability. These are all elements that we constantly think about and include as we approach our work and how we engage in the communities. Again, the health inequities that we know, existing health status, access to care, environmental conditions, all those things are constantly on our mind. Strong relationships that are based in understanding this SES and health, social status and economic status of communities and where they are, individuals. The impact of education and health. We know that's a critical component, and understanding that we have to work very hard and we have to be very intentional about how we put out the messages that we need to put out, or that our agencies and the ones we're working with, how they put out that information, because not everybody's going to be texting, not everybody's going to be on Instagram, right? So we have to think and be very intentional and considerate of the communities we're working with, or that we need to work with, and how they receive and how they interpret and how they engage in utilizing information. I can't stress that enough. And then our efforts, again, we're currently the coalition is involved with COVID-19. We're continuing that work. Now we're looking at the work of the impact from the COVID-19. We have different initiatives in mental health, behavioral health, suicide prevention, suicide awareness. We have multiple steering committees with each of the identified cultural identity groups. Again, as we always do with any of these opportunities, if anybody would like to get more involved with the coalition or get involved with some of our steering committees kind of at the grassroots level where we do this work, we're always willing to take volunteers who want to get involved and work with us in those areas. And then I think we're up to our last slide. Again, there'll be 2 more sessions that we'll be doing. The next one is actually going to provide you with examples of faculty who utilize community-based participatory research in different avenues of their work. And so you'll see again, Dr. Christopher Johansson, who's with us live today. His work will be presented. Dr. Manaj Sharma, who has years of experience in CBPR. Dr. Jennifer Carson from the School of Public Health at UNR. And Dr. Amanda Haybush-Deloy here from the Children's Policy Research Institute here at the UNLV School of Public Health. So there'll be real examples of how CBPR is utilized in their work. We hope that everybody can make it and see how this really plays out in reality of actual research and projects that have been going on. At this point, we have about 7 minutes left. Are there any questions or comments that folks would like to open up and share with us? Just raise your hand or speak up and we'll try to call on you. Again, we have a guidebook that goes with this presentation. It is in the chat if you want to download it. It's there. And again, we'll be adding to it as we go along, as we get more information. Again, I would invite anybody here, if you've had any experience with CBPR or community engagement and there's some recommendations you'd like us to think about, please email us or put it in the chat. I think they put our contact information in the chat for everybody. All right, not hearing none or seeing none. I think we have a, Taylor, do we have a post evaluation that we want to put in there?
Yes, Sarah posted it in the chat for everybody.
All right, so there is an evaluation there. Folks will be so kind as to take a minute or two to complete the evaluation for us. Let us know how we can improve this. This is going to be an ongoing series. So in academic terms, this will be done once, maybe twice a year, fall and spring semester. The recording will be available to everybody so that you can look at it anytime you need to. And again, of course, you can reach out to any of us for any one-on-one conversations or opportunities to collaborate or work together. I know some of our newest partners are on the call today that we're going to be beginning some work with. So a very busy time for public health. Dr.
Let us know what other issues or very specific things within CBPR. Like this was really just an overview. So if there's any specifics in here that you wanted to learn, want us to focus on for future webinars, please let us know that too.
And I wanted to point out this effort, everything we're doing right now in Nevada, Dr. Lucero, myself, we've all had the privilege and the opportunity to work with Dr. Barbara Israel out of the Detroit Urban Research Center that is housed in Detroit, but out of the University of Michigan. And I cannot say how much they've actually been instrumental in helping the coalition as we got off the ground utilizing CBPR. They did some of our training a couple years back. They've worked with us. They continue to work with us. So they are real partners. And if anybody has a chance, go to their website, the Detroit Urban Research Center. There are a ton of resources, online programming, training, takes you more in depth with the understanding CBPR and how you can utilize it in whatever world you exist in the work that you're doing. So it's a great resource that's available to everybody. And I can't say enough of good things about them. They've had a big impact on how I approach my professional work. And so I'll forever be grateful to them. So.
Jose, there was a question in the chat. What are the next steps for community partners that would like to get involved?
So great question, everybody. Again, if you go to our website, we have applications there for new partners who want to join up. You can either join at the level of a associate member, kind of, I want to be on the newsletter, I want to attend the membership meetings. Our membership meetings are quarterly. Next one will be in January. They're always the last Wednesday of the month. They start at 12 and we try to wrap up by 1. Sometimes we go a little bit over, but we try to be mindful of everybody's time. Depending on how this pandemic continues to go, there'll be some kind of live version of the meetings, keeping the virtual connection because we are a statewide coalition, so that everybody can participate. And people might not feel comfortable coming out live yet, so the virtual connection will always be there. Then the next level is the allied member, where your organization wants to join and you actually want to serve on a work group or a steering committee. Work groups include programming, communications, strategic planning, strategic relations, and policy. The steering committees are based on the cultural identity groups. So African American, Native American, Latino, LGBTQI+, Pacific Islander, Asian Pacific Islander, and multicultural, because we understand a lot of our Latino work has been done in Spanish, but not every Latino speaks Spanish, right? And so there is the multicultural version of everything that we're trying to do. So multiple ways that you can get involved, and you can go to the Nevada Minority Health and Equity Coalition website and look at that information. You can email us, or you can put your information. We have your information there. We'll follow up with everybody. And if you want to go to that next level, get involved with the coalition, then we will make sure to follow up with you. Thank you for that. Thank you for that question. Always love pushing the coalition. So anything else? Any other questions? And I want to acknowledge some of our board members that are on the call. Pamela Atkins Gerard is with us. I saw Tom McCoy was on there. Several staff members are on there today joining us. Thank you. A lot of this work is supported by graduate students here at UNLV who support everything we do and all the crazy ideas we get. So thank you to all the students that are on board with us. And again, if you can join us, the second session, there'll be real examples of CBPR. And then the third session, we're going to try to address the question of how do you fund this kind of work. All right, with that being said, I'll thank everybody for joining us today. And we'll look forward to connecting to everybody. Be safe, enjoy the holiday, whether it's Harvest Festival, Thanksgiving, or whatever you celebrate. Thank God and thank you to all of our veterans who have served that we're going to be celebrating tomorrow. And we'll see everybody at the